This is Kendall. Kendall displays sensory seeking behaviors. She often feels dysregulated in class. This can be distracting to the other students, and it prevents her from learning at her fullest potential. She also has a hard time keeping her hands to herself. This is Davis. He has a hard time staying alert in school and often feels lethargic and tired. This can make it really hard for him to pay attention when the teacher is talking. This is Maya. Maya is diagnosed with autism spectrum disorder and often feels overstimulated during bedtime, which makes it difficult for her to fall asleep. This can ruin her sleeping schedule and make her tired during the day. Amy, the school's occupational therapist, has seen these behaviors or heard about them from parents and teachers. She believes these students need a sensory diet. So, what is a sensory diet?
A sensory diet is a personalized action plan that gives your child the unique sensory input his or her body needs at that very moment. These sensory experiences include visual, auditory or sound, gustatory or taste, proprioceptive, which is movement of body in space, touch, vestibular, which has to do with balance, and interoception, which has to do with sensation of internal functions. Reasons to use a sensory diet include sensory overload, sleep disruptions, emotional meltdowns, difficulty with transitions. Sensory diets also improve attention and self-regulation, and they also encourage purposeful movement. Creating or making an individualized sensory diet. Creating an individualized sensory diet may be a challenge as there are many different factors to take into account. A good place to start would be by making a list of activities that the child enjoys and that help to stimulate or regulate their body. It is also important to consider some other factors, which include: does the child's weekly behavior differ from weekend behaviors? What times of day are we talking about? Morning, after school, evening, or bedtime? What about environments? Home versus school? Does the child have a safe space or a room where they can go and get regulated? Is a child over or under responsive? This will help determine which types of activities you choose. For example, calming or alerting. What triggers upset or agitate the child? There are so many other factors to consider when creating a sensory diet. These are just a few. A sensory diet is created and prescribed by an occupational therapist who works in close collaboration with parents, teachers, and other professionals who work closely with the child. Now, let's check out some examples of a sensory diet.
In many instances, the occupational therapist informs and instructs the student on how to perform their individualized sensory diet. Then, when the student understands what is needed of them, they are often able to perform most of the sensory diet themselves throughout the day, or with guidance from the teacher or therapist. In these cases, we will assume each student thoroughly understands their sensory diet and is able to implement it with little or no guidance.
Kendall is a 7-year-old girl who is easily distracted and has a hard time staying focused, on task, and in her seat during class. Kendall is seeking input and may benefit from a sensory diet of deep proprioceptive input when she starts the day and every 1 to 2 hours throughout the day to help her stay regulated and to get her through her day. When Kendall first arrives at school, she puts away her backpack, then sits at her desk with a weighted blanket on her lap. Great job, Kendall. Additionally, throughout the day, whenever Kendall is feeling overwhelmed, she is encouraged by her teachers to do deep breathing exercises. Notice how she checked herself before she wrecked herself? Next, we have Davis. Davis is a 6-year-old boy who has a hard time remaining alert and attentive in school. At home, his parents say he is slow and lethargic, especially right when he wakes up in the mornings. Davis would benefit by having activities implemented into his daily routine that will help him stay alert and attentive to get him through the day. At the beginning of class, Davis is asked to hand out the morning activity. What a great helper! In the afternoon, he walks with a peer to bring the daily attendance sheet to the office. The office staff just loves seeing him smile every day. During class, if Davis is having an extra hard time paying attention, his chair will be switched out to a ball so he can bounce and stay alert. Look at Davis using those techniques. Way to go, Davis. Sensory diets are most recognized in the school setting, but a sensory diet can be created and used for anyone having difficulties in regulating their sensory needs. A perfect example of a sensory diet created outside of the school setting is with our next client, Maya. Maya, age 13, is having trouble falling asleep at night. Maya is diagnosed with autism spectrum disorder and is easily distracted and overstimulated before going to bed. Maya's occupational therapist has developed a sensory diet that will be implemented into her normal bedtime routine. This will help her address her sensory needs and help her self-regulate in order for her to fall asleep successfully. At 7:30 p.m., all devices are turned off, and Maya reads a book under low lighting. Good choice, Maya. When she's done reading, she brushes her teeth. Looking good. Then, she does some light yoga in her room with an oil diffuser on. Lavender oil, preferably. "30 minutes before lights out, Maya lays in bed with her weighted blanket. She performs calming breathing exercises and body scan meditation. Aum. 9 p.m. rolls around. That means lights out. Maya turns on her noise machine and closes her eyes. Good night, Maya. Sweet dreams."
If you think that you or someone you know may benefit from a sensory diet intervention, talk to your local occupational therapist today.